Hi, this is Mike Tierney of Data Not Distress, and in this video I'd like to discuss why is Greenland so great. So Greenland is a tiny island country of 57,000, but still, if they had the same death rate to COVID-19 as the United States, they would have seen about 93 deaths. But instead, Greenland saw a different number of deaths. So, you see how you can see me right through the middle here? And ignore my arm for a second. But do you see how this shape is round on all sides? So now, there's only one number that you can see right through the middle of and is round on all sides. Only one. And that is the number that Greenland has to use to describe the number of COVID-19 deaths that they've seen. And that number? It's 0. Now, if you listen to the news, it seems really strange to me that all we hear about are these panicked disaster cases, the number of people dying in places that are handling airborne disease incorrectly, and yet no one talking about the cases where they did good, like Greenland, with 0 deaths. Don't you think that if we actually had a medical science somewhere, anywhere, that was actually interested in saving lives, that they'd be crying to the heavens, look at Greenland. Here is a case to emulate. With 0 deaths. Wouldn't we want to do exactly what they did? Wouldn't we want that case in the news and let everyone know what they did to get these amazing results? Well, there's a simple reason for that. How did Greenland get to those 0 deaths to all of their COVID-19 cases? One simple method. They had every single one of their cases stay home and stay away from hospitals and stay away from doctors. They had their cases do what we've been doing about cold and flu successfully for millennia. And it comes down to one simple rule. If you feel sick, stay home. Everyone else, live a normal life, be around others, go to work, frequent businesses. Don't live in fear. But somehow this example seems to have been lost in all the breathless hype. Is it perhaps because the way to get to 0 deaths to COVID-19 doesn't sell anything? It doesn't give the doctors, the same doctors that have been handed the reins to guiding our public policy, they don't get to bill insurance and make money off the backs of the dying. One of the interesting articles I've seen over the last year was a doctor in the US asking, where did all the non-COVID patients go? Well, let's see. You have one building with people with heart problems, lung problems, kidney problems, people whose bodies are too weak to survive the common cold. Then you're going to pull all this pandemic terrorism and you're going to scare people to run off to the hospital at the first sign of a runny nose, giving everyone there the common cold, including all those people whose bodies can't handle it. And then you're going to wonder why all your hospital patients suddenly disappeared. And then we're going to wonder where all these deaths came from. There is one simple method to get to 0 deaths from COVID-19. And Greenland has it.